Juvenile arthritis, JA, also called juvenile idiopathic arthritis, JIA, is a broad term used to describe a group of autoimmune and inflammatory conditions that affect children under the age of 16. Unlike adult arthritis, which often develops from wear and tear of joints, juvenile arthritis is the result of an overactive immune system mistakenly attacking the body's own tissues. This disease can cause persistent joint pain, swelling, stiffness, and long-term complications if not managed properly. What is juvenile arthritis? Juvenile arthritis is not a single condition but rather a collection of subtypes. The word idiopathic means that the exact cause is unknown. The immune system, which usually protects the body against infections, becomes overactive and starts attacking healthy cells in the joints. This leads to inflammation that damages cartilage and bone, affecting movement and growth. The condition can last for months or even years, and in some children, it can continue into adulthood. Types of juvenile arthritis. There are several recognized forms of JA, each with unique features. Oligoarticular juvenile arthritis, the most common type, affecting 4 or fewer joints in the first 6 months. It often involves large joints such as knees, elbows, or ankles. Some children also develop eye inflammation called uveitis. Polyarticular juvenile arthritis, affects 5 or more joints within the first 6 months. It can involve both large and small joints, including hands and feet, and is more common in girls. Systemic juvenile arthritis, Still's disease, involves not just the joints but also internal organs. Children may experience high fevers, rashes, swollen lymph nodes, and inflammation of the liver, spleen, or heart. Psoriatic arthritis, occurs in children who have both arthritis and psoriasis, a skin condition. Symptoms may include pitted fingernails, scaly skin patches, and joint inflammation. Enthesitis-related arthritis, involves inflammation where tendons attach to bones, especially in the hips, knees, or feet. It is often linked with back pain and may be associated with conditions like ankylosing spondylitis. Undifferentiated arthritis, when symptoms do not clearly match one specific subtype, doctors classify it as undifferentiated. Symptoms of juvenile arthritis. The symptoms of JA can vary widely depending on the type and severity, but common signs include persistent joint pain or aching, swelling and tenderness in joints, stiffness, especially in the morning or after inactivity, fatigue and reduced energy, limping or difficulty moving joints, unexplained fevers or skin rashes, eye problems such as redness, pain, or blurred vision. Because symptoms can come and go, with periods of flare UPS and remission, JA can be unpredictable. Causes and risk factors. The exact cause of juvenile arthritis is unknown. However, it is believed to involve a combination of genetic, environmental, and immune system factors. Children who inherit certain genes may be more susceptible, and an environmental trigger such as an infection may activate the abnormal immune response. While JA can affect any child, it is more commonly diagnosed in girls than boys. Complications. If left untreated, juvenile arthritis can lead to serious complications. Joint damage, chronic inflammation can erode cartilage and bone, leading to deformities. Growth problems, inflammation and steroid treatments may interfere with bone development. Eye inflammation, conditions like uveitis can cause permanent vision loss if not managed. Reduced quality of life, pain and limited mobility can affect school, sports, and social activities. Diagnosis. Diagnosing JA can be challenging since no single test confirms the disease. Doctors rely on a combination of medical history, physical exams, blood tests, and imaging studies such as X-rays or MRI scans. Tests may include checking for inflammatory markers, anti-nuclear antibodies, ANA, or rheumatoid factor, RF. Early and accurate diagnosis is critical to prevent complications. Treatment and management. Although there is no cure for juvenile arthritis, Treatments focus on controlling symptoms, preventing joint damage, and maintaining quality of life. Treatment plans are tailored to each child's condition and may include medications, nonsteroidal anti-inflammatory drugs, NSAIDs, disease-modifying antirheumatic drugs, DMARDs, corticosteroids, and biologic agents that target the immune system. Physical therapy, exercises and stretching routines help maintain flexibility, strength, and joint function. Healthy lifestyle, regular physical activity, balanced nutrition, and adequate rest are important for long-term health. Surgery, in severe cases where joint damage is extensive, surgery may be necessary to repair or replace joints. Living with juvenile arthritis. With advancements in treatment, many children with JA live full and active lives. Support from family, schools, and healthcare providers is crucial. Emotional well-being is also important, as chronic illness can cause stress, anxiety, or depression. Joining support groups and connecting with others who have JA can help children and families cope with the challenges. Conclusion. Juvenile arthritis is a complex autoimmune disease that affects children at a vulnerable stage in their growth and development. Although its exact cause remains uncertain, medical research and new treatments have greatly improved outcomes. With early diagnosis, proper treatment, and ongoing care, children with JA can manage their symptoms, protect their joints, and lead fulfilling lives.